Congratulations, you have decided to have your hernia repaired. The providers and clinical staff at St. Peter's General Surgery feel it is important for you to understand the surgical repair and what to expect from the healing process after surgery. The following presentation has been made to complement your visit and reference at any point during any stage of your planning and recovery process. Patients often ask about how the surgery is performed. During your consultation, the surgeon will discuss the safest repair method for your case, all while considering any underlying health issues you may have. The options often discussed are open, traditional laparoscopic, or robotic-assisted laparoscopic repair. Our Da Vinci Xi robotic-assisted laparoscopic system is a state-of-the-art surgical technology that provides advanced, minimally invasive surgery assistance through a computer-controlled robot mastered by our surgeons. This allows for reduced hospital stay or even same-day discharge, reduced post-operative pain, and a quicker return to a normal quality of life. There are many cases where the surgeon will choose traditional laparoscopy or open surgery for your repair. The goal is to provide you the safest and strongest repair possible. Binder to be placed while you are still in the OR. This is often an attempt to decrease seroma development and helps to support your abdominal wall. Abdominal binders are meant to be a support, not a brace. Ideally, patients will begin to need the support less and less. As you can see, the length of wear decreases each week to avoid weakening of the abdominal muscles. A seroma is a post-operative collection of fluid in the space where the hernia was once present. This fluid can be lymph fluid or even blood from the surgery. This is a normal occurrence after surgery and is very much dependent on the size and location of the hernia. Ways to prevent a post-op seroma are applying ice to the surgical site for a duration of 20 minutes multiple times a day. Use compression. That may require you to get supportive underwear or a jock strap for inguinal hernia repairs, abdominal binders for ventral hernia repairs. If a seroma develops, the clinical staff will advise you to apply moist heat. Moist heat is best applied using either a microwave rice beanbag or an electric heating pad with a moisture barrier or pad in place. Just like ice, these methods are applied for 20 minutes, 1 to 2 times a day, to encourage absorption of seroma fluid. This method is also beneficial to loosen muscles before stretching or being active. Please refer to the patient education video, Moving After Abdominal Surgery, on proper stretching and movement after applying moist heat. If you are a male who develops a large scrotal seroma, warm Epsom salt soaks using a sitz bath or a shallow tub is beneficial. Follow the instructions on the Epsom salt container for the amount needed based on the volume of water you are using. It is important not to soak your fresh surgical incisions under the water to avoid infection. Despite your efforts, it may just take time for the seroma to reabsorb into your body. This process can take weeks or even months to achieve. However, if the large seroma persists for 6 months or more, this may require an evaluation by the provider. Here is a simple recipe to make your own rice bag. Find a long sock or stocking, fill it 3/4 of the way with dry rice, tie it off at the end, and microwave for about 1 to 2 minutes. Apply to the affected area. This is a document that we will be reviewing at your post-op appointment. It will review in detail how to progress safely through the weeks after surgery. It is important to understand that the recovery time after surgery takes several weeks from the day of surgery. And performing normal activity is not expected until approximately 6 weeks post-op. However, we will discuss at your appointment how you can gradually increase activity safely during those weeks to prevent other complications from occurring. Again, reviewing the video, Moving After Abdominal Surgery, will help you prepare better for your recovery. Some patients require FMLA and disability paperwork to be completed for their place of employment. This is often a confusing and stressful time for many patients after surgery. To clarify the basics, Family Medical Leave Act, or FMLA, protects your job while you are on leave from work. Short-term disability will provide a percentage of your pay while out of work. These forms vary from company to company, so we rely on the patients to obtain these forms from their place of employment. You must complete the employee section of all forms prior to submitting to the office for completion, and sign the consent to release the medical information to your employer. Forms would have to be picked up or mailed if this is not completed and can delay processing. I hope this presentation helped you prepare for your upcoming surgery and your recovery. Do not hesitate to contact the office if you have more questions or concerns. Our staff can also send you a link to MyChart, our patient portal through Epic, so that you have direct communication with us. Thank you from the providers and staff at St. Peter's Hospital, Hepatobiliary, Pancreatic, and General Surgery.